Alright, today we're going to do an assessment of a newborn. This baby's just been born, brought it straight over here to the table. I'm going to make sure that this baby is in a position that the head is lower than the feet. We're going to use our bulb syringe to suck out the mouth. We're going to get the nostrils. Once I've done that, I want to dry this baby off real good. We want to kind of be a little vigorous a little bit. I want the baby to cry. That way it promotes their lungs and make sure they get good oxygen in there. Once I get that all done, I want to remove the baby. Get me a clean one here. Okay, we'll lay that baby there. Now, I can wrap this baby or use a warmer. Babies like to be warm. Once I do that, I'm going to do an Apgar scale. An Apgar scale is done 1 minute after a baby is born and 5 minutes. On the Apgar scale, I'm going to listen to the heart rate for 1 minute. Okay. I'm looking at the respiratory effort. Is this baby retracting, using its stomach and muscles to help breathe? How's a baby breathing? That kind of thing. Once I've done that, I want to look at the overall appearance of the baby. I'm looking at the color, muscle tone, reflex, irritability, things like that. If they're, you can kind of tickle their feet and they'll pull back from you. Fingers in their hands and they'll grasp onto you. So, the overall general appearance of this baby is actually really good. I'm going to move to the umbilical cord. I'm looking at the umbilical cord to make sure that there's no bleeding. I'm making sure that there is 2 arteries, 1 vein, that everything there looks good. Next, we're going to do a set of vitals. First, I'm going to do an axillary temperature. Okay, temperature is good. We're going to do get a blood pressure. I want to make sure that we get the right size blood pressure cuff that fits these babies. We'll do that. Once I do that, I want to get a respiratory rate. Sometimes you got to keep your hand close to the baby, or keep your hand close to the baby at all times, but getting a respiratory rate, sometimes if you put your hand on their chest, you can see it moving up and down a little bit better. We'll count that. Also, I want to do a brachial pulse, femoral pulse. Everything looks good. I'm looking at the overall appearance of the baby. I'm looking for lanugo, or the small thin hairs that appear on the baby's body. Everything looks good. I'm going to set my baby up to do this part. I'm looking at the molding of the head, if there's any edema. I'm looking at the fontanelles, making sure they're not deviated, or that they're protruding. I want them to be soft or smooth, straight across. Once I've done that, I want to look at the overall appearance of this baby, make sure that there's nothing abnormal about it with its toes and extremities, face, body, ears, anything like that. I want to make sure that everything looks good. Also, I want to, before I ever take this baby away from its mother, I want to make sure that the bracelets match. Baby's bracelet to mama's bracelets. Once I've done that, I want to get a circumference of the head. And to do that, we'll just measure right above the eyebrows. And once I've done that, I want to get a circumference of the chest. And that's done right on the nipple line. Okay, let's get a total length of this baby. That's done from the top of the head to the bottom of the feet. Okay. Excuse me. Once I've done that, I'm going to pick the baby up. I'm going to zero out my scale. I'm going to lay the baby back down on it. We're going to measure that baby in pounds, ounces, kilograms, and grams. Once that's done, I'm going to take and put a little bit of eye ointment in the corner of its eyes. That'd be after I would clean them out with some cotton balls. I want to put a diaper on my baby. this baby. Okay. This baby's also going to get a vitamin K shot. Okay, put a Band-Aid over top of that. Once I've done that, then I'm going to swaddle my baby. Again, babies like to be good and warm. Once I've done that, I can give baby back to mom and dad, or mom, whoever's there. Maybe it's just dad, or maybe it's just mom. That will complete my assessment of a newborn.